So the nurse came and told me that the patient refused to sign the consent. We talk to the patient, explain the benefits and risks of the procedure, why we're doing the procedure, do a timeout, and that's when the consent is signed. So I talked to her and asked her what her concerns were. She was an older lady, and she, of course, had read something on Facebook, of course, and she said it was something, it's called Olympus. Yes, all the scopes are made by Olympus. It's a big company. Most of the facilities have that scope. And it was a lawsuit because the scope had given somebody an infection. I said, well, it happened some time ago. It was a special scope called the duodenoscope that's used for a special procedure, mostly only in the hospitals. And for people that have serious problems, that's when we do this procedure. And there was some problem with cleaning the scopes because of the special way the scopes were designed. That problem has been fixed. The cleaning protocols have been updated. There are new rules and guidelines all of us follow. She said, well, I don't want to get the infection. Well, you're not going to get it. If you visit our facility, you'll see 160 people getting scopes every day and leaving home safely, and they all come back for further procedures too. Well, what about my sleep apnea? Well, so you should be worried about your sleep apnea at home, not when you're here doing a procedure, because 4 people are watching you here: the doctor, the nurse, the anesthesia person. They're all looking at you and your oxygen level, your carbon dioxide level, to make sure that you're breathing properly. When you're at home, and especially if you don't use your CPAP machine, your oxygen is going down, your carbon dioxide is going up, and your brain stops breathing, and you gasp for air, and you wake up, and that's your snore. Or suddenly you wake up, or your partner witnesses that you stop sleeping for some time, and that's super dangerous. Well, what about my tonsils? Are they going to get in the way? No, they're not. So, well, I said, if you're not comfortable with this procedure, we don't have to do it. No, I guess I'll do it. I said, I did the procedure myself, and here I am. When there's a need for a procedure, don't put it off for the fear of one thing or the other. Because she had all these questions and concerns. There's one thing I say: when I went to sleep, I trusted my doctor fully. I trusted my staff fully to take care of myself. I didn't choose that I want this nurse or that anesthesia person. I said, all of you, I trust you to take care of my patients, so I trust you to take care of me. So whoever happens to be in the room that day is fine to take care of me. So have some faith in your doctor, in your medical profession, that they will do the right thing for you. No one is doing anything intentional. Complications are rare, but they can happen. They will happen to somebody, depending on a lot of factors, not just somebody's fault, somebody's mistake. If you remember that, you will get your procedures and your medical care peacefully and calmly, and hopefully will get you to where you need to be, happy and healthy.